That depends, of course, in the status you are. It's in the bad times, it was a loss of smell, loss of taste, and those are very, I think, underestimated problems. It gives you a lousy feeling. Even you have no idea if yourself maybe are smelling uncomfortably. So it's so that's a problem, and of course the fact that you have a breathing problem. You feel uncomfortable. Also know that you're unhappy if you think, is there a drop on my nose? Because sometimes you feel it, sometimes you don't feel it. So those are I would say, the first things which are popping up in my mind. And my advice to patients is find the right help. The primary physician has very often a tendency to underestimate the situation and say it's a normal cold or take some aspirin, but in my case, for instance, is very dangerous because I'm an asthma patient, so I should not take aspirin. What I should also advise in definitely not take the aggressive medicines which you can get over the counter. They open your nose for a while, but the damage is afterwards much higher. And what for me, one of the best things is, what I could advise is the nasal shower. I think I learned about it I think 5 years ago. And the nasal shower, sometimes I even compare as a nasal orgasm, because it opens your nose, and if you do it also combined with your medication, it's a very nice way of opening your blocked nose. The good thing of EUFOREA is that we have a platform where we can exchange experiences, ideas about treatment with other patients, but also with experts from the industry, experts from the medical environment. You can talk to all those people, and for me the positive thing is they're very interested in the way we see it. For instance, we had a discussion, what is the most important thing? And a lot of people were surprised that loss of smell is for most of the patient the most important thing. And EUFOREA tries to bring all those discussions together and promotes. Of course, we have 2 years of Zoom discussions. What was the disadvantage that it's Zoom? The advantage, though, is that we had now about 15 to 20 patients from all over the countries in Europe exchanging ideas. And then you can see there's a big difference in treatment as well as in experience how to handle this disease.